A hearty good afternoon and welcome to a session on breast milk's nature's health insurance plan. We're glad to have Dr. Latika Uppal among us today to help us explore the topic. Breast milk provides an abundant and easily absorbed nutritional components, antioxidants, enzymes, and antibodies from the mother to the child. These antibodies enter the milk and help protect the baby from illness. It is super important for us to understand the importance breastfeeding plays for early for children, for young infants. Hence, we are lucky to have the doctor with us today to guide us on the topic. Doctor, you have the stage.
Right. Hi, good afternoon, everyone. I am Dr. Latika Uppal. I am Senior Consultant Neonatology and Pediatrics at Apollo Cradle, Amritsar. So today we are here to discuss about breastfeeding. Breastfeeding is basically nature's health insurance policy, and that too for free, right? So, what exactly is breastfeeding? So breastfeeding is providing your infant with breast milk, most likely direct breastfeeding. It can also be expressed, pumped and expressed breast milk, and which can be provided to the baby. So most organizations, including the American Academy of Pediatrics, recommends exclusive breastfeeding for the first 6 months of a baby's life. Now, we'll go about it in stages. How do you know, now that you're a new mother, how do you know that your baby is hungry? So babies usually give cues of hunger, all right, which is manifested by licking their lips, sticking out their tongue, putting hands in the mouth, sucking on objects, or they can be fussy. They start crying. How often should you feed your babies? So newborns need to be fed every 2 to 3 hourly. Within 2 to 3 months, once your baby turns 2 to 3 months old, you can feed every 3 to 4 hourly. And 6 months onwards, you can feed around, say, 4 to 5 hourly. Now, why is breast milk so important for a baby's development? Every mother's feed is tailor made for her own baby. So, for instance, if you have a preterm delivery, the nutritional composition of your milk changes accordingly. A term lady may have a different composition of milk. Breast milk has a world of benefits for the baby as well as for the mother. So, first we'll discuss the benefits of breastfeeding that are there for the mother. So, breastfeeding produces naturally soothing hormones, oxytocin and prolactin, which naturally releases stress from the mother, makes her calm, makes her relaxed, and hence fights against postpartum depression. Now, postpartum depression is a very, very rampant problem in our country and often undiscussed, because that kind of supportive care is most in quite a few cases it's not offered to a new mother. So breastfeeding is your antidepressant in a way, as it soothes the mother, relaxes and calms her down. Also, positive feelings are generated in nursing mothers. Once you hold your baby, once you cradle your baby while feeding, these hormones help develop maternal and infant bonding, feelings of love, feeling of maternity that gets released, and that again acts as an antidepressant and helps prevent postpartum depression. Oxytocin, prolactin also help involute your uterus. So basically, your organs which have expanded during the birth start reducing back to their normal size and position. Now, we all know that we do put on weight during pregnancy. Most of us do. Some of us are blessed enough to, remain in shape and have a belly only pregnancy. So breastfeeding is it's basically you running on a treadmill. Breastfeeding burns a lot of calories. It's approximately 500 calories per session. So that also helps you lose the accumulated weight, the weight that you've accumulated during your pregnancy. It is a natural way to reduce weight and to get back into shape. Breastfeeding women tend to lose weight, their pregnancy weight, faster. It also increases a mother's confidence and self esteem. You're nursing your baby, it's easier, it's more convenient. and no financial investment as such is needed, no equipments are needed. So it also enhances a woman's self-esteem and confidence. It increases calmness. Now, breast milk is full of good bacteria, pro and prebiotics, which help in the intestinal development of a newborn baby. So these babies tend to have decreased colic, decreased fussiness episodes. They are more calm, they have lesser colic, they are less fussy compared to formula fed babies. They cry less, and they have decreased childhood illnesses. So breast milk basically supports your wellness, both mind, body, and soul. Also, the breastfed infants, they tend to have decreased hospitalizations, decreased illness episodes. So that also, instills a sense of confidence in the mother and the family. Now, colic is a very disturbing. Infantile colic is a very, prevalent issue. Also, it disrupts the family's functioning. You have a constantly crying baby at home. It causes a lot of tension amongst the family members. It has also led to increased infantile abuse again. So breastfeeding protects against this. Breast milk, when you're a feeding mother, it makes your travel easier. You're free to travel, as there are no hassles of carrying bottles, sterilizers, bottle warmers, costly equipments along. So breast milk is very safe, it's easy, it's convenient, it's economical. You can do it any time of the day and without any special assistance or no special equipment. So it's always present at an ambient temperature. Direct breastfeeding, breast milk always released at an ambient temperature. So it's a very travel friendly option. Physical and emotional bonding of the mother and child increase while breastfeeding. So maternal infant bonding, when you cradle your baby, when you stroke your baby, when you caress your baby, as I said, maternal bond, the feeling of oneness increases. That's why we also recommend rooming in, that a mother and infant should stay together 24 hours of the day. So this increases the maternal infant bonding as well. Increase skin to skin contact, increase stroking, it improves the affectionate bond, and thus also reduces chances of antisocial and behavioral problems later on in childhood and adulthood. It also helps shape up a newborn's early behavioral and emotional as well as IQ development. Breastfeeding mothers, they learn to read the infant's cues and are a little more involved. Babies also learn to trust the caregivers. It's a two-way road. So this helps shapes an infant's behavior in the future as well. It also protects the mother against a lot of diseases. So there is decreased risk of breast cancer. It helps in decreasing the risk of ovarian cancer. There is decreased risk of rheumatoid arthritis, cardiovascular diseases. There is decreased risk of lupus, decreased risk of endometriosis, osteoporosis, hypertension, obesity, even postpartum depression. So all these diseases are prevented merely by breastfeeding. So what are the stages of lactation? In the first few days, what the milk that is produced is a thick, the composition is very thick. It is dark yellow in color and it is known as colostrum. So colostrum is full of antibodies. Basically, it's a natural antibiotic, you can put it that way. माँ का पहला गाढ़ा दूध. So it is very important that an infant is skin to skin contact is made and directly latched to the mother within half an hour of birth. So we usually, both during normal deliveries and cesareans, immediate skin to skin contact and latching is recommended soon after birth. Colostrum helps develop, it lines the baby's digestive tract with probiotics and good bacteria. So it helps develop the immature digestive system of the newborn. Colostrum is full of IgG, IgA, secretory IgA, then bifidobacterium lactoferrin, your it's full of antibodies, so it's very very important. Now there is a practice in most part of our in many parts of our country, wherein honey is given as a pre-lacteal feed, gurti kaha jata hai. So you can do that, but then instead of honey, do it with this golden liquid colostrum, which offers a world full of benefits to the newborn baby. So colostrum is very important. After that, in the first few days, transitional milk comes, which is more watery in consistency. This remains for 4 to 5 days after birth. By 10 to 15 days, mature milk starts coming. So, for pumping mothers, even when you express, the initial milk, the fore milk, is more watery in consistency. It quenches the baby's thirst. It has more of lactose. And the hind milk contains a lot of fat content. And this is what offers satiety to your baby. It is yellowish in color. It is of a yellowish hue, and it usually comes after 10 to 15 minutes of directly feeding or pumping. So, there is a common question which mothers usually ask: am I making enough milk? Is my baby getting enough milk? So, if your baby is not losing more than 7% of its body weight after delivery, within the first 4 5 days after delivery, your baby seems content for at least 1 to 3 hours after a feeding session, or your baby has at least 6 to 8 soiled diapers, with the yellowish or transparent urine. And in other words, if your baby is passing 6 to 8 urine per day by day 7 and day 7 to 10 of life, then that means that the baby is adequately breastfed. After day 7 of life in term infants, 20 to 30 gram per day of weight gain is expected in a baby who's adequately fed. Now, which many mothers will ask, which is the best position of breastfeeding? So, the basic position of breastfeeding is the one in which you are comfortable in. There are many positions. The first, the commonest position is the cradle hold, where you hold your elbow like this, and your infant is resting on the flat of your forearm, and you directly breastfeed the baby. Now, there is an entity which is known as football hold, wherein you're resting the palm, the baby's head and back is supported on your palm and forearm, and this is how you hold the infant and you directly breastfeed. So this is for mothers who are recovering from a cesarean section and want to avoid any kind of pressure or strain on their belly. There is also sideline position, which many mothers utilize at night, wherein they breastfeed the baby while lying down in a sideline position. There is something which is known as a football hold. Then there is cross cradle hold, where you hold the infant across the opposite breast, opposite arm, and you can directly nurse the baby. So whichever position you and your infant are comfortable while feeding is important. Okay, and there is no best position as such when it comes to breastfeeding. Now, how to latch? You need to gently stroke the baby's lower lip, wherein the infant opens its mouth wide. Both the lips should be puckered outside. The chin should be resting on the it should be touching the breast, and the entire areola, the brown portion around the nipple, should go inside the infant's mouth, wherein the baby forms a teat, and that is effective latching. Otherwise, what happens is that the baby will suckle only on the tip of the nipple, and hind milk does not come out. Also, then that will be a very painful experience for the mother, and this again disrupts the breastfeeding and also the mother infant bonding. Now, certain tips for the mothers: you need to get regular prenatal care. Try and have regular antenatal checkups. Take breastfeeding classes antenatally as well as, of course, after delivery. Make sure that you take lactation consultation wherein required. It's not always necessary that if you have one babies or two babies, every child comes with a different experience. So if you're finding it difficult to breastfeed the baby, please take help from your lactation consultant, your neonatologist, or your gynecologist. Ask your doctor to latch on the baby and make skin to skin contact immediately after delivery, so that breastfeeding is started as soon as possible. Now, what are the ABCs of breastfeeding? First and foremost is awareness. Watch for hunger cues. Look for signs of hunger in your baby. On-demand feeding can be started initially. In initial phases, we recommend that up to 2 months, baby should be breastfed every 2 hours. But then on-demand feeding can also be done. You can look for cues of hunger, and once you feel that the baby is hungry, you can start breastfeeding. This is known as on-demand feeding. Be patient. Per side, minimum of 10 to 20 minutes of feeding need to be done. While your baby is feeding, you can gently stroke the forehead like this, flicker the soles or tickle the soles, or you can rub behind the baby's ears, because newborns tend to sleep more. So this is just a way to keep them awake during the feeding session. So 10 to 15 minutes per side is enough. Don't directly, pull the baby while the baby is suckling. You can gradually insert your finger during the and break the seal, because while sucking, a vacuum is formed. If you directly push the baby away, suppose to latch onto the other side, you may develop sore nipples or cracks or feel pain. So gently detach the baby after 15 to 20 minutes, and if the baby is still hungry, offer the other side of the breast. Comfort. You need to relax. You need to wait for the milk to flow down and for the milk to let down. um, Over getting over stressed and over anxious about milk production is not good, and it should not be done. Now, what are the benefits of breastfeeding for the babies? It's an ideal nutrition. It's an ideal nutrition for the infant. It's easily digested. It is full of pro and prebiotics. It's full of antibodies and immunoglobulins. So it helps develop a child's immune system very well and helps them fight against diseases. Breastfed babies tend to have decreased incidences of gastrointestinal diseases such as diarrhea, decrease respiratory illnesses such as pneumonia, decrease ENT illnesses such as secretory otitis media. It fights various infections including viral, bacterial, and fungal. There is decreased risk of allergies and asthma. Breastfed babies, because their immune system, as I said, breast milk is a major tool in shaping a newborn's immune system. So this helps prevent allergic diseases as well. There is something which is known as sudden infant death syndrome, SIDS, wherein due to certain causes, an infant, otherwise healthy, well-growing infant, may suddenly pass. So breastfeeding protects against SIDS as well. Breastfed babies tend to have an higher IQ compared to formula-fed infants. It helps develop their intelligent quotient. Breast milk is full of DHA and its precursors. So this helps develop a baby's brain and also its intelligent quotient, and shapes their memory, their brain development in a better manner. Breast milk also helps shape an infant's behavior. Early latching, stroking, direct breastfeeding, this help develop an infant-mother bond. These babies tend to have reduced incidences of antisocial behavior, stress episodes later on in life as well. Breastfeeding also prevents against cardiovascular diseases. It helps protect, it causes ideal weight gain. So there is no undernutrition, there is no overnutrition. So it also protects against childhood and adult obesity, decreases the risk of hypertension, decreases the risk of cancer, and various other such disorders in a baby as well. So breastfeeding has plenty of benefits for an infant too. Now, what are the challenges that you can, firstly we'll hit the contraindications. What are the contraindications of breastfeeding? HIV positive mothers can also breastfeed, but then again under the supervision of your caregiver, your doctor. Active and untreated tuberculosis is a contraindication of breastfeeding, as there is a tendency to pass it on to your baby. If the mother is on antipsychotic or antidepressant medications which are not compatible with breastfeeding, then breastfeeding is contraindicated. Chemotherapy. Mothers who are taking active chemotherapy or immunomodulatory drugs, breastfeeding is contraindicated. Now, any mother who's taking marijuana, cocaine, substance abuse, breastfeeding is discouraged. Babies who are lactose intolerant or have galactosemia, breastfeeding is contraindicated in these babies as well. Now, what are the challenges that you may face while breastfeeding? So sore nipples can occur because of, as I said, suction, or improper latching, or not letting the nipples air dry between two feeds. Sometimes fungal infections, thrush can happen both for the baby as well as for the mother. So you may develop cracked and sore nipples, which are painful. So for this, you can apply topical creams containing cocoa butter, lanolin jelly, to help ease out the pain. Correct latching and positioning is very important. Mastitis. Mastitis is when breast milk is not expressed properly, and it keeps pooling up. Sometimes the ducts tend to get infected, leading to engorgement and mastitis. So this can cause high grade fever in the mother. The breast becomes engorged, red and painful. You can apply hot compresses, express the milk properly, and feed your infant. Uh, we do advise we do advise oral painkillers, as well as sometimes antibiotics are also required to treat this completely. Dry cracked nipples can occur, which sometimes tend to bleed as well. So again, lanolin and nipple buttercream, letting the nipples air dry between two feeding sessions, this is very important. Then stress, worry about not making enough milk, constantly fussing about the baby. So these are signs of postpartum depression. Early recognition and good supportive care is the key here. Inverted nipples, this needs to be checked antenatally, because this can disrupt breastfeeding and can also hamper the mother infant bonding. So inverted nipples is something that needs to be checked on every antenatal checkup of yours, and adequate exercises for the same are recommended. Breast engorgement and duct blockage, you may notice a single white tip around your areola or nipple, or a serpiginous swelling. So one or the other duct tends to get blocked, which is again a painful condition. Proper latching and proper breastfeeding helps alleviate this. And now there are sometimes I get certain questions from others. I'm having fever, or I am having flu. Can I breastfeed my baby? Yes, of course, you can breastfeed your baby. Rather, your antibodies against that particular disease will pass through your milk onto your infant. Now, mothers many a times ask, can they store breast milk? Yes, you can store breast milk, express it and store for up to 3 days in the fridge, and up to 6 months in deep freeze. Once you bring it out in room temperature, warm it in you can use a cup with warm water, place the milk container in it. Once it reaches room temperature, you can give that milk to your baby for the next 4 hours at 24 degrees temperature. After that, you cannot, once you have heated mother's milk, you cannot reheat it. Do not attempt to heat breast milk in microwave, or on gas, or thaw it. Then that denatures the milk and destroys its immune properties. I hope I have been able to hit upon every important point regarding breastfeeding. So let's promote and support our mothers to do exclusive breastfeeding for the first 6 months of a baby's life. I'd be happy to take questions if any. Okay, so Sandeep has asked, can we save extra breast milk from one mother and use it for some other baby? Yes, of course, you can do that, Sandeep. In fact, there is something which is known as breast milk pooling and breast milk banking, which is practiced in most of tertiary care hospitals, wherein pooled mother milk from other mothers are utilized and given to those babies whose mothers, for some reason, are not able to breastfeed the baby, or are not able to provide their expressed milk. So you can very safely do that. I think that's all. There are no further questions. So I thank you all for joining me in today's session, and I hope that you at your in your own houses, in your families, you help and support feeding mothers to exclusively breastfeed for the first 6 months. Thank you very much. Have a very good day.